Governor Cooper is a genius and had a coup for being able to woo our very first speaker from running policy in Washington, D.C. to North Carolina. Secretary Dr. Mandy Cohen was the Chief Operating Officer and Chief of Staff for the Centers for Medicare and Medicaid Services through the turbulent healthcare reform years of the last several years, helping manage Medicare, Medicaid, and the Affordable Care Act through the last several years. And she came to North Carolina a year ago to be our Secretary of Health and Human Services. For those of you who were here last year and raised your hand, she gave a speech on her very third day in office and looked like a pro. Well, now a whole year later, she's going to give us the scorecard for how her organization did, and perhaps maybe a state of health address, if you will. Secretary Cohen.
Good morning. It's great to be back. Thanks, Brian, for that kind introduction, and that's right. This forum 1 year ago was the very first speaking engagement that I did as Secretary of Health and Human Services. I followed my boss, the governor, who spoke right before me, and it was the first time I had the chance to hear him speak in public. Frankly, it was the third time I'd ever met him. First was at my interview, and then when he introduced me when I got nominated. And so he shared his vision for North Carolina, which is what brought me here. And you will likely hear him say it later today. He wants a North Carolina that's more educated, that's healthier, that has more money in their pocket, so everyone can live a more abundant and purposeful life. What a fantastic vision. I was excited to sign up on his team and to make that a reality here. But then the next line he said a year ago was, and now let me introduce Dr. Cohen to tell you exactly how we're going to do that. And I thought, okay, boss, we haven't really had a chance to sit down yet and talk it through. So I'm glad to be back a year later to share a little bit more about what we've been working on over the last year, and it really is in service of the governor's vision of that better educated, healthier, more money in your pocket vision so folks can live a more abundant and purposeful life. And for me, and many of you who have heard me talk over the last year, you know that our focus at the department, and mine in particular as the official who's really focused on health for this state, is thinking about, well, how do I use all of the dollars that we have in the state, the time, the resources, to truly buy health for the state of North Carolina, right? Step back and say, okay, I want the healthiest North Carolina we could possibly get, and so how do I buy that, right? And for me, that goes back to value. How do we get the most quality for the dollars that we're spending in value? And I wanted to start with a patient story about how I, as a physician, did not bring a lot of value to a particular patient's life, and it has now shaped me and how I think about decisions for the future, and then I'll go into our priorities. So I'm finishing training at Mass General Hospital in Boston. I'd finished medical school. I'm almost done with my residency training, and I'm seeing someone in my outpatient clinic. It's a young woman, she's 24. She has commercial insurance. She has Blue Cross Blue Shield of Massachusetts insurance. She's a college student full-time. She comes in with some vague complaints. She's losing weight. She's just generally not feeling well. Maybe she's losing some of her hair. And I'm feeling pretty good about myself. I went to Yale for medical school, right? I'm thinking, okay, I'm going to ask her about her family history. I order some pretty expensive lab tests. I'm really good at that. They all came back normal. I wasn't exactly sure what was going on with her. I see her a second time. I think, okay, maybe it's not anything easy like an anemia or something. Maybe it's an autoimmune disease. God forbid it's a cancer. Start imaging her head, her belly, can't find the answer. Third time I'm seeing her, 7 or 8 weeks into our relationship, she doesn't look good. And I'm talking it over with my preceptor. I'm still a resident, I'm still learning, and I'm sort of asking my mentor, where do I go from here? I've ordered a lot of tests. Now I'm thinking, what specialist should I send her to, right? I'm a primary care doctor. Maybe it's time to bring in someone with some specialty knowledge. when my nurse tech who had checked the patient in comes over and says to us, "I think you need to ask her if she has enough to eat." And that was a moment that was really humbling for me, embarrassing, really, because I went 8 weeks before asking her a really important question about her health. Do you have enough to eat? And she didn't eat for 8 weeks because of me, because I was ordering expensive lab tests and expensive imaging tests, but I wasn't asking her some fundamental questions about her health. And so, that was a pivotal moment for me, because I said, wow, I really need to start thinking differently about what we're doing here in every patient visit that I see, in my clinic, in our hospital system, in our community, right? And so I'm so lucky to have this opportunity here in North Carolina to really start to look at that big picture about that value, about how are we putting our dollars together. And for me, I'm not going to forget to ask that question again. And so I want to think about and we know there's a lot of really good evidence and science now about how we need to think about things like unmet needs around food or transportation or housing, and how that impacts someone's overall health. Think about your own health, right? When you think about what keeps you and makes you healthy, do you think about all the time you spend in your doctor's office? Or do you think about your New Year's resolutions? Did you go to the gym? What are you eating? Did you quit smoking? Right? Those are the things that make up your health. And so as the official who thinks about the health of North Carolina, I want to embed that into every decision that we are making. So let me show you how that plays out in our three priorities that we're focused on. First is a big transformation that's happening in our Medicaid program. Second is around the opioid crisis. And third is a focus on early childhood. So first, on our Medicaid program, as many of you know, we're about to shift our Medicaid program, which covers 2 million people in the state, and we're about to shift it from a state-administered program to one where private insurance companies administer the program. And we're the largest state that has not yet moved to managed care. So we're in a really good spot. We can learn a lot from other states that have done it well, and even some who haven't done it that well. And so we're excited about that opportunity, but it really gives us the chance to take a look at our program and say, are we really buying health? We spend $13 billion with a B every year on the Medicaid program, and are we really using our dollars to buy health? And so as you look at that transformation, we've been thinking about it in 3 domains and 3 things that we really want to make sure that we're doing. One is thinking about the whole person. And for me, that means their physical health, their mental health, and their unmet social needs potentially, and putting that all together in one package for thinking about that person. Right now, we have a siloed system where we pay for bills related to your physical health over here and your mental health over here, and it's caused a fracturing of the way we deliver care. But as a primary care doctor myself, I know that you don't take off your hat on your physical health or your mental health as you walk in my office. And so we shouldn't do that in the way we think about how we pay for the care. So we really need to bring all of that together, the physical health, mental health, and the unmet social needs. So you will see that as we continue to move forward, and we've been having very good conversations on how to make that a reality in our law so we can take that out in our program. So a lot of agreement and movement forward there, the work to do. Second is needing a robust quality strategy, right? I've talked about value. I want quality for every dollar that we spend, and so that means holding all of us accountable from the state down to the individual doctor, nurse, provider for really important outcomes. And it's also about how do we use how we pay to drive towards that quality. I bet you're going to hear a bit about that from my friend and colleague, Patrick Conway, who's, I'm sure, thinking about that differently. And we want to align with a lot of the work that's happening in the Medicare space, where we think about paying differently and using alternative payment models instead of paying piece by piece by piece, really thinking, again, about that whole person as we move through things. And then lastly, you'll see a big emphasis from us on that link between unmet social needs, the strain around food or housing or transportation, and healthcare. So a couple ways in which we're doing that. One is don't be like me. We have to do real screening. We have to ask the question. Right? My issue was my patient didn't look like, right, someone who ran out of food. She was a college student. She had Blue Cross insurance. She looked perfectly put together, and I didn't ask the question, but we have to ask the question. And this isn't just about asking the question of those who are in the Medicaid program. We know that in the commercial population as well, people with private insurance, they also struggle with some of these things, but we have to ask the question about health. So one is asking the question, and then when we actually find out the answer, we actually need to get people the resources and navigate them to the resources that exist, because they are there. They're there in our community, but we need to knit together our healthcare system and those social services that are in the community. And then lastly, we need data. We need data to know what works. If I invest in something related to food or housing, is it really giving me better health, right? Going back to that, am I buying health? Am I getting value question? So you'll see the Medicaid program make a big investment on trying to build the evidence base for what to really invest in. I'll give you an example. Here in North Carolina, at Cone Health, they piloted a program related to kids with really bad asthma. When kids have really bad asthma, they end up in the emergency room a lot. And what Cone Health did, instead of continuing to pay for those and treat kids in the emergency room, they went to their homes, they ripped up their carpet, put down new carpet, and gave them an air filter. And guess what happened? Less emergency room visits, lower costs, mom and dad back at work, kids at school. How often in healthcare are we getting wins like that, right? When we can actually spend less, get better outcomes, mom and dad more productive at work, kids learning at school, right? That's what we want. And so I want to build the evidence base around buying carpet. So I want to use my Medicaid dollars to buy carpet because I want to buy health. So that's our Medicaid work, and it's a lot of exciting stuff going, and I know a lot of you in the room are engaged in that. So thank you on the partnership for that and for running fast with us to do this work. Second, let me mention the opioid crisis. It is something I spent a lot of time with my colleague Josh Stein, our Attorney General, focused on this effort over the last year. We've done a ton of work, also many of you in the room. We put together a coordinated action plan across the state. We had new legislation passed. We've seen the number of prescriptions of opioids go down, but a lot of work still to do. Too many folks are dying every single day. The number of emergency room visits that we're seeing for overdoses is skyrocketing, even with the fact that we have 50,000 doses of naloxone that were distributed at the end of last year. We're still seeing the numbers go the wrong way. And this isn't magic. We actually have the science, we have the evidence, we know what to do. We just have to wake up every day and do it, right? So that's a lot of things, right? It's not one thing, and it's not one thing in the healthcare sector, which is why we have that coordinated plan. It's getting people access to treatment, but it's also making sure we're getting upstream and doing the prevention work. It's also getting the number of prescription opioids down, and then it's also working with our law enforcement partners to make sure we're getting illegal heroin and fentanyl off the streets. So it's a very big job, and like I said, we need the continued effort and continued energy to all work together on that issue. And then third, let me leave you with our third area of work, which is really our focus for this coming year. Similar to how we did the opioid work, we're thinking about how do we do coordinated work to focus on early childhood, that 0 to 5 in particular age group. And our department touches the lives of children in so many ways. It's incredible. We cover 1.5 million children's lives. We pay for half the births in the state. We run the NC Pre-K program, the Child Care Subsidy program. We run Child Protective Services and others. So we at the department really need to think differently about how do we bring a lot of those pieces together to do better for our families and for our kids. I've been really moved, and I hope you may hear over the next 2 days about some of the real interesting research about brain development between 0 and 5. I think that's become very common now, where we know that 0 to 5 time is really when a lot of those neural pathways are getting laid, and that it's really important to make sure that kids are healthy and safe and being nurtured and being read to and hearing language. But what's really been fascinating to me is the newer research I've been seeing about what happens to children when they experience trauma, and what happens to your physiology, and how your physiology actually changes for the rest of your life when you experience trauma as a kid. And that can be anything from your parents getting divorced to you actually having, unfortunately, abuse in the home, or seeing a parent with a substance abuse disorder, or being food insecure, right? Any of those traumas actually makes your body act differently for the rest of your life. Here's really interesting research. Back at Mass General, where I trained, they have a bariatric surgery clinic, right, for those who are obese and awaiting surgery. And they administered a survey asking about childhood trauma or adverse childhood events to those who were awaiting bariatric surgery. And 80% of those awaiting bariatric surgery had 3 or more childhood traumas. 80%, 3 or more childhood traumas. That made me think very differently about my work as a primary care doctor, right? I'm trying to fix diabetes and get people to stop smoking and think about their weight and that connection to their blood pressure, right? And when I needed to think about, wow, what happened to them as a kid, and going way back upstream of that, which makes me think about spending our time investing in our kids 0 to 5. And so we are thinking about a coordinated approach across 3 domains. One is around health. It goes back to that buying health. Are we getting value for all the dollars that we're spending, and really focus on making sure kids are healthy and developing well 0 to 5. But then they have to also be safe and nurtured, right? That goes to the brain development and making sure that they're getting that social interaction. Because we know that if you put a kid in a box with the healthiest food and getting their flu shot, but they're sitting in a box and not talking to anyone, they're not going to develop their brains in the appropriate way. So it's really about that human, social, nurturing, and interaction. And then lastly, are they learning and ready to succeed when they come to school? And we know there's a lot of good evidence. That's not just being in pre-K. That's being in pre-K with a really qualified teacher. It's reading to your kids at night, but it's also making sure kids aren't coming to school hungry, because you can't learn if you're hungry. So all those things are things that we're putting together in a coordinated plan. And again, for me, it's not necessarily about net new things, but it's about that coordination across all of the things and the ways that we touch children and families at the department. So stay tuned for more on that. And I'm a data gal, so you'll see a lot more on how we're trying to measure some of those things and really drive improvement across the work that we do for early childhood. So that's a lot, and I hope our picture over there captures my theme of value and buying health, our focus on our Medicaid program, and making sure that we are focused on that whole person, our opioid crisis, and really this is about keeping that focus and energy on the work that we're doing related to opioids. And then lastly, around early childhood, and how do we focus all of the ways in which we think about children across that continuum of health, nurtured, learning, ready to succeed, and how do we do better for the kids here in North Carolina, again, to go back to the governor's mission statement, so that we can build a North Carolina that's more educated, that's healthier, that's got more money in their pocket, so they can live an abundant and purposeful life. And I'm not just kissing up to my boss. I think that's a fantastic vision for our state. I need all of your help to actually make that possible, but I've had a fantastic first year here. Thank you for being a wonderful first place for me to be a year ago. I hope you are proud of some of the progress that we're making across the state, and just thank you for the attention and the hard work.